What is the most reliable test to detect heart attack? This is the question. As you may be knowing that if anybody is suffering from heart attack or pain in the chest, and when there is a strong doubt that he or she may have a heart attack, then there are certain tests available that can rule out a heart attack, whether it is or not, the person is not suffering from heart attack. The common test is the ECG and echocardiography and blood tests. But all these tests, they cannot definitely tell you whether it is a heart attack or not, because ECG can be abnormal in many conditions and echo can also be normal in many conditions. Then what is the test which can definitely decide that the person is suffering from heart attack or acute myocardial infarction? It's not all patients are not having first time heart attack. There are many patients who have 2, 3, 4 times in their life a heart attack. So there is a most reliable test recommended by American Heart Association and European Cardiac Association. That test is called troponin testing test or Trop T test. Trop T is a device which is readily available in the market, and the test does not require any preparation. And in many hospitals this kit is available, and even if in poor countries, if it is not available, it's not very expensive. You can buy it from a chemist shop or a test diagnostic shop, and after you buy the kit and provide this kit to the doctor, within 5 minutes they can tell you whether it is a heart attack or not. Trop T device test. Just what is needed is a kit which is easily available in the market and a syringe through which blood from the patient's vein is taken out, and the test is performed and the result comes just in 5 minutes. Troponins are enzymes in our heart muscles. When there is injury or attack on our heart muscle, these enzymes are released, troponin enzymes, and they come in the blood, and the doctor can detect these enzymes through a device called Trop T test device. So this is the most reliable, easily available, easily can be performed, no much preparation is required, not very expensive, highly affordable and highly reliable as well. And within injury, 2 to 3 hours within an injury, these enzymes are released and they can be detected through these devices. And I hope many of you were not knowing it before, so you should know it. The most reliable test is Trop T test, and it can diagnose a heart attack, and even it can diagnose heart attack in patients where ECG cannot show it because there are changes. Maybe the patient has 3-4 heart attacks back and the changes are still seen in the ECG. So Trop T test would indicate a latest and new heart attack. And also there is another use of this test. If a patient is having chest pain, repeated chest pain, pain on walking, pain on climbing stairs, so you can do this test repeatedly over days and weeks to rule out whether this pain in the chest is due to a heart problem or something else is going on inside. So repeated Trop T test can show if there is damage to the heart. And I hope this information will help you. We'll be back again with new question and its answer.